Hi, everyone. Thank you so much for coming. I'm excited to introduce our speaker. My name is Dr. Ashley Logan, and this is Dr. Kelcie Willis. Dr. Willis got her PhD in clinical psychology from Virginia Commonwealth University in Richmond. She then went on to Yale to complete her residency, and she's doing her 2-year postdoctoral fellowship up at MGH in Boston. So this is a full circle moment for us. So I don't know if you guys were at our presentation yesterday, but Kelcie was my mentee for years before going on and exploring the world. I vividly remember the first time I was invited to come to the ABTA conference. Kelcie was my mentee, and I remember sharing it with my lab, how excited I was, because as clinicians and researchers, usually the conferences we go to are with colleagues, right? Peers, other scientists, other physicians, other clinicians. And very rarely do we get to stand in front of the people that we serve and actually talk to them about all the great work that we're doing that is hopefully improving y'all's quality of life, both for patients and caregivers. So I remember how excited Kelcie was for me when I got that opportunity years ago, and now I get to present her for the first time at her ABTA National Conference premiere, debut. You guys are in for a huge treat. Dr. Willis is literally becoming the guru for caregiver quality of life, and I'm so excited for you guys to hear her speak.
Thank you. I wasn't ready for that. Thank you for that kind introduction. I'm Kelcie Willis. I am so honored and privileged to be in a group of caregivers and maybe some patients too. Like Ashley stated, these are the people that I think about and write about, and I often get to meet in my one-on-one therapy sessions, but to be in a room of people that really inspire me, it's an honor to be here. So as Ashley stated, I'm a clinical psychologist by training, and I've chosen to specialize in neuro-oncology. I've been doing that for the past 5 or 6 years now. I'm also a researcher, and I put my Twitter up here, or X, whatever we're calling it these days, at Kelcie D. Willis. I post about some of our research articles, and so you might find some of the findings interesting. I'll also be posting about recruitment opportunities or opportunity to participate in research studies. I'm currently developing some things just for caregivers. So if you want to stay in contact, that's a way to follow along. So today we're going to be talking about nurturing caregivers' well-being, a topic that I'm very passionate about. Just a show of hands, who was at the session yesterday with Dr. Logan and I? Oh my goodness. Thank you so much for coming for round 2. You may see a couple of similar slides here, but we're going to get into greater detail about caregivers. Any patients in the room? Raise your hand, say hey. 1, awesome. I'm so glad you're here. I'm going to be speaking directly to caregivers today, but I still think that there's probably nuggets in here that might make you think a different way. I'm passionate about ensuring caregivers are not forgotten. So often the focus is on the patient, and it needs to be. To some extent, but it feels as if caregivers are not considered in the conversation as often. And there's a few reasons for this. And so today I'm going to be talking about strategies as a clinical psychologist that I've found to be helpful for caregivers' well-being. So I have nothing to disclose. What we're going to be doing today, I hope, this is a pretty small room compared to yesterday. I hope that we can make this kind of interactive. I know I'm standing behind a podium. I tried to walk around so it wouldn't feel like there's a wall between us. But if you have something that you want to say, raise your hand. I'm going to have some opportunities for us to share. We're going to do 2 activities. We're going to talk about some of the problems I've heard from caregivers and in our research. And then we'll talk about 3 strategies for nurturing your well-being. And I've pre-warned everyone, this is a session for caregivers, so hopefully a safe space for us to really talk about the real, raw things going on. All right, we're gonna start with an activity here. I want everyone to raise your hand if this applies to you, okay? At any point since the diagnosis, have you cried, let's just say alone, where the patient didn't know? Have you felt completely overwhelmed? Have you had difficulty sitting with uncertainty, not knowing what the future is going to look like? Have you felt hopeful? Have you felt like maybe you weren't doing the right thing? You're not sure if this is how you're supposed to be a caregiver. Are you missing something? Did you do something wrong? Any hands there? It's really normal. Notice strength in yourself that you did not know that you had. Yeah. Could not sleep due to worries or racing mind. I want you to look around. Let me go back. Did you notice everyone raised their hand for the majority of those responses? What's so crazy about this is you all raised your hand for almost every single one of these. And what I hear most often from caregivers is how alone they feel. Raise your hand if you feel alone or isolated. Yeah. Thank you to the ABTA for providing this awesome opportunity for connection and community. There's a lot of reasons why caregivers may feel alone. One is this is a really unique role. Brain tumors are rare. Being a caregiver for someone with a brain tumor is rare. You know, probably in your day-to-day life, you don't know other people like you. Medical providers don't often have time to really get into what's going on with the caregiver. They may ask sometimes, but to spend a lot of time with the caregiver-specific issues, it's just really not built in our healthcare system right now. We want to change that, but that's just where we are right now. And then you might be isolating yourself a little bit, understandably so. You might feel like you want to protect what's going on with the patient for their own dignity. You may not want to share with others what you're seeing, or maybe you're embarrassed about some of the things you feel as a caregiver. Maybe you don't want to tell someone that you're feeling burnt out. And so there could be a lot of reasons why you feel alone. But the great thing about today is that there's our session just for caregivers. We're in a room full of caregivers. And I challenge you all, if you have not already, to meet a caregiver today, exchange your name, a contact, phone number, email, and have someone to build your community. So show of hands, you're a caregiver right now. Let's see them. Hi. All right, make eye contact. Keep them up. Look at each other. Okay? I'm going to pause here. Tell your name to someone. And if you're online, I think there's a chat feature. Y'all go ahead. You can put your name in the chat, and I think if you feel comfortable sharing, you can either put your contact information or people can actually send you a direct message. All right, so everyone, make eye contact. Get a couple phone numbers. Yes, I see some handshakes. There we go. What about this gentleman sitting at the table by himself? Has anyone talked to him? Yeah. I'm serious. The people that will understand are in this room. Get to know them. All right. So I had this slide up yesterday. These are some common challenges I hear from caregivers, okay? And pay attention to this list. I want to see some head nods if this is true. And if I miss something, I'm going to have y'all let me know. All right. Navigating healthcare. Oh my gosh. How long have you been on the phone with insurance or specialized pharmacies, or tried to figure out like the gateway to talk to providers? Or maybe you're in a doctor's appointment with a patient and you're like, do I tell the doctor what's going on? Do I let the patient tell the doctor what's going on? It's hard. The healthcare system was made for patient-provider. It's hard to integrate the caregiver. Maybe you're the family point person, so everyone is constantly asking you for updates. Maybe you're having trouble seeing changes in your loved one, and that could be functional changes. It could be personality changes. It could be changing roles, like maybe they used to take care of the finances and they used to plan a lot, and now you're doing that. And maybe you're taking care of the patient and your kids and your parents, and you're taking care of everyone. Maybe you're still working. Maybe you're noticing emotions that you didn't know that you had. Maybe you used to be really independent, and that's feeling really difficult to do. And maybe you're thinking ahead of, what is this going to look like? What treatment choices am I going to make? Do I need to be planning ahead? How does that sound? What am I missing here? If you have something, okay, we have someone.
Trying to get information that you need and want from the person with the brain tumor who just doesn't want to discuss it.
Good one. That is good. Thank you for sharing. Okay, we got another one up here. You're going to get your steps in today.
I think the other thing that happens is that the person that I'm caring for oftentimes thinks that he can do more than he actually can. And to juggle that in between, yes, you think you've done this, but no, you haven't, and now I need to redo it.
Right.
And how to do that while still honoring his independence, but still getting the thing that has to be done.
What a difficult tightrope to walk. You're in charge of taking care of this person and making sure they're okay, but you also want to treat them with respect and dignity and encourage them. Anything else that I missed? Okay. Oh, we have another one.
I think it's been a challenge to get the appropriate amount of influence from my partner, who I'm now caring for, and trying to find that healthy balance between continuing our healthy marriage and also making sure she's taking care of herself.
Absolutely. Absolutely. It changes a marriage. You know, the dynamic of patient and caregiver, that's new. And what implications does that have for even things like sex and intimacy? There's a lot of changing factors at play. So all of these challenges, and there's probably more, never came with a manual. And I say that to validate each of your experiences, that you are doing the best you can without a clear roadmap of what to do. You didn't choose to be a caregiver in a lot of instances. You wouldn't have it any other way. But just like the patient, this was probably thrust upon you. You know, a lot of stories are, everyone has a different story, is the patient had a seizure, they go to the ER, they find a mass, they have an emergency surgery, and then all of a sudden, it's 0 to 100, your life has totally changed, and you've never done this before. You're doing the best you can. You didn't go to medical school, right? You're navigating a lot, and there's no manual for this. So I want to validate your experience here. And because there's no manual, because caregivers often feel alone and they have all of these challenges and all of these things they're juggling, and there's no clear answer of how to do any of this, caregivers report a lot of mental and physical health problems. So I had this slide up yesterday. Let me give you some statistics, okay? About half of caregivers will have clinically significant levels of anxiety at diagnosis, and that will stay the entire course of the disease trajectory, 50%. About 20 to 30% of caregivers will be prescribed an antidepressant, which is compared to about 10% of the average US population. About 70 to 80% of caregivers will report having clinically significant levels of death anxiety, where they are thinking about the patient's mortality and suffering all the time. A little over half of caregivers report poor sleep quality, and many of them have rates of inflammation due to stress and not taking care of themselves. So those are some numbers for you. This is a real issue. And I'm sure you're all doing your best, but I just say this to validate. If you're having a hard time, of course you are. This is really normal. So we've talked a little bit about the problems, some of the challenges, some of the consequences of these challenges. Let me share 3 strategies as a clinical psychologist that I found to be helpful. I'm going to be talking about taking care of yourself. And before you roll your eyes, hear me out. I'm going to be talking about how to allow yourself to receive support, Keyword is allow. And I'm going to talk about how to find small moments of joy, imperfect joy. So let's start at the top here, taking care of yourself. How many of y'all are sick of hearing self-care, self-care, self-care? You're like, what can I do? I'm doing everything I can. You are. How many of you have heard of the oxygen mask analogy? Yeah. Okay, for y'all that have not heard this analogy, it's pretty powerful. If you've ever flown before and you've ever paid attention to the safety instructions, you'll hear flight attendants talk about, in case of an emergency, oxygen masks will fall down, and it's important that you put on yours first before anyone around you. And the image they will show is a mom and a young child, and they want the mom to put on the mask before the young child. And why do they do that, right? Why do they encourage that? Because you're useless if you are not okay. Notice I didn't say if you're not perfect, if you're not thriving. I said if you're not okay. You can't pour from a totally empty cup. That doesn't mean that your cup has to be totally full, but it has to be, you got to have some gas in the tank here. So what I want to say is, yes, self-care, but let's allow shortcomings for self-care. You can't go back to how things were before the patient was diagnosed. Self-care is not going to be perfect. Can we get the basic things met, though? Can we find a way to get sleep? Maybe that's respite care. Can we make sure we're eating and feeding ourselves? Can we get some steps in? Can we have some social connection? That is a basic need. There's a reason why in prisons they have social isolation as a max punishment, right? Social connection is important. That's not a luxury. And another way to think about self-care is quiet time. So you could think of quiet time as in actually sitting in a quiet room or a quiet backyard and taking deep breaths and enjoying a moment of doing nothing. You can think of quiet time as quieting your mind. And you could be in a loud space, but you're not letting all of that chatter take over. So one strategy we talk about as psychologists is worry time. So worry time is the intentional practice of giving yourself a break from anxiety. That you can worry about this 12 hours a day, but maybe 1 hour you don't worry. And anytime you notice a worry come in, you say, I'm going to come back to that in 30 minutes. I'm going to come back to that in 30 minutes. But like just this, even 5 minutes, I'm just going to sit here and not entertain these worries. I'll come back to them in a second. I watched the survivorship talk today, and there were some great strategies about mindfulness, prayer, meditation, yoga. These are all great strategies for quieting your mind. I'd say develop a mantra. So I have one here. You're welcome to steal, and I want us to say this together. Repeat after me. I'm doing the best that I can. I will give myself grace during this difficult time. I'm a human being, not a robot, not a superhero. It's okay to have feelings and needs. And those are important. Those are really important. So this may seem cornball. That's okay. But say something to yourself that gives you permission to make mistakes and not have all the answers. You need a break from that anxiety and that pressure. All right, let's talk about number 2. Allow yourself to receive support, okay? Here's how to do this. If you have a piece of paper and you want to practice alongside me, I say do that, or if you want to use your phone, that's great. I would say let's jot down a couple of needs you may have. And I have this checklist. There are practical, logistical needs like bringing dinner, rides, emotional needs like a place to vent safely, esteem needs, hearing that you're doing a good job, financial needs, social needs, informational needs, getting good information, knowing who to ask. Maybe that's another caregiver, and maybe that's a medical provider, maybe that's a specialist. Notice which of these needs you feel more comfortable asking for. I'm going to guess it's probably more of the practical needs and less of the emotional needs. But just write down a list of everything that exists, and then start writing a list of who is in your social circle. Who can you ask? And if your circle is limited, 1, we were making friends today, right? And 2, let's think about a professional, like maybe a psychologist could help with some of the emotional needs. And what you're going to do is you're going to match needs to the person that can provide that need. Not everyone is good at providing emotional support. Not everyone can provide financial support. So we want to match need to person. And then we have to use our voice to express those needs. I have a script for you, so stay tuned. You have to ask. They cannot read your mind. And if something is getting in the way of asking, we're going to have to talk about that too. So stay tuned there. And then repeat, because you don't ask things one time. You have different needs that pop up through this journey, and that's normal and that's okay. All right, so I'm going to give you a script for how to ask for what you need. Who here feels like they're a pretty independent person and they've been able to get by more or less without a lot of help? Yeah, some people strongly feel that way and identify that way, and they have. And I would just say a brain tumor changes the game. There's new rules now, and it is hard to do this alone. So here's a script for you. The first thing you're going to do is you're going to describe the facts of what's going on. I have an example here, but you're just going to use facts. You're going to set the stage. I want you to remember DEAR. D is for describe. Let them know what's going on just using facts. After you set the stage, I want you to explain to the person how those facts make you feel using I statements, not you statements, not blame. You're going to own your feelings and say, these facts make me feel this way. Then, after you set the stage and say how it's affecting you, you're going to actually explicitly state your request. Like, those for dummy books, the yellow for dummy books, like that. You're going to spell it out clear as day what you need, or say no if you need to say no to something. And then after you do that, you're going to reinforce, you're going to tie it up in a pretty bow, and you're going to say why it's important. And if you can't think of why it's important, you're going to just say, thank you, it would mean a lot to me. Okay, so let's look at this example. So I made this up here. First step D, describe the facts. I'm having trouble keeping up with appointments, maintaining a clean household, keeping up with my work responsibilities, and getting enough rest. Does that sound right? Here goes the explain or express. I am feeling overwhelmed and tired and would really appreciate the extra support. Can't stop there. You have to explicitly say, could you please ... We'll come back to that. Doing so would allow me to rest and prepare for the journey ahead, allowing me to be a better caregiver. I really appreciate it. Okay? Use this script for all of those needs. Find people that can meet some of these needs. All right, let's talk about what could be some of the requests. Can you please communicate this medical update with the rest of my family on my behalf? Can you sit with my loved one while I take a nap? Can you give me some encouragement? Don't be afraid to ask that. Can you give my loved one a ride? Can you take my kids and take them on a play date? Can you bring us dinner? Can you help me clean? Can you not ask me about this unless I bring it up? Can you remind me to go on a walk or encourage me to find a therapist or help me find a therapist? Can you look up this clinical trial and see what you find? Can you listen to me vent and say really ugly things that I don't totally mean without judgment? What am I missing? What are some requests that would be helpful? Oh, right here in the front.
Sorry, can I have you speak into the mic? Thank you.
So, in our support group back in Northern Virginia, we kind of talk about it this way. On some of these. Some of these you do have to do this directly. Some of because you always get people, call me if you need anything. Thanks for piling something else on my plate.
Right, it's another task.
I'm not trying to be mean. You don't say that, but that's just, we've all got this much stuff.
Right.
Some of this, they can be, it's like, call me to take the kids, or call me and say, hey, I'm bringing dinner Thursday night. What is your thoughts on doing that as opposed to asking for everything,
Yeah, I
as opposed
know.
to ask for a few things and ask people to be assertive? If that's the wrong word, let me know. But being more direct and telling you, hey, I'm coming over on Thursday to clean the house for you, or
Yep.
whatever. Your thoughts on that, or anybody else?
I mean, I wish we had all of your family and friends here and I could tell them that right now, that, you know, like, let's just offer some things. You're so right about that. I think what could be coming up is this thought of, I shouldn't have to ask, or I can't always ask for this. And that is true. And the most effective way you can get your needs met is by using your voice. And so maybe for this situation, you're saying, hey, I'm not going to remember to ask, and it's hard for me to ask. I've never had to ask anyone for this. Could you regularly offer to take the kids? Just for, like, let's just say the next 3 months or the next year. Just offer that. Instead of saying, let me know, just offer kid stuff. Offer meals. Offer rides without me asking first. So maybe that's a one and done. And hopefully they can step up to the plate. We have to give them a chance to. What else am I missing? I'm going to leave room if there others have requests that I'm missing.
I think the harder one, and you have only one example up there, is asking someone not to do something. So setting that boundary of, like, I have family members that continually want to provide alternative, in my opinion, crazy answers to my husband's condition.
Yeah.
Getting particular treatments from India and whatnot, right?
Yeah.
From some black market thing. So to be assertive enough to ask them to not
I know.
interfere with that is, those kind of things I think are harder in the ask process.
Thank you for sharing. You're so right. And it's intention versus impact, right? They probably have great intentions, but it's annoying and not helpful. I'm going to go back here. Bear with me. Let's go back to the deer. Okay? I'm going to just practice in real time here. I've heard you mentioned a few alternative treatments to us over the years. So that's a fact, right, dear? I hear you say that, and I know you have the best intention in mind, and you really care about us. But right now, it is more helpful for us to go this medical route. And hearing about these other ideas just causes us more stress and more things to consider. Could you please not bring up alternative therapies directly to me and my loved one while we're on treatment? I know that you mean your intentions are so pure and you're trying to do everything in your help, but I would really appreciate it. Thank you. It's so hard. But communicating your needs is also saying no, and it's tough. Okay, I'm going to move on here. Thoughts that may be getting in the way. So you may know that you have these needs. You may know that you need support, but it just feels hard. And you've brought up two great points of why it's hard. I want to know if you've ever heard yourself think this: no one can do X like I can. I'm a burden if I ask for this. I'm a burden if I tell my loved one how I feel. They have a brain tumor. I can't tell them how I feel. I shouldn't be feeling this way. I should be enjoying every moment I have with this person. I shouldn't be feeling angry or irritable. I'm not doing enough. The future of their well-being is in my hands. If I'm not looking up everything and researching everything all night and all day, then I could miss something and I could be the reason why they don't live. No one else could ever understand. Uh-oh, I gave it away. Are those thoughts that resonate? Any of those resonate? What I would say is these are thoughts, not facts. They may have a kernel of truth to them, but they may be getting in the way of you getting your needs met, and your needs are important. You've got to take care of yourself. You're on a different journey than the patient, but your needs are still as important. And so if these are thoughts that are getting in the way of sharing your feelings or getting support you need, let's see if we can loosen our grip on them. And as I was going to show, what would you say to another caregiver? I highly doubt that you would put as much pressure on another person on this room to have everything figured out and to do everything all the time. So remember that self-compassion. What would I say to someone else or another caregiver? All right, strategy number 3, finding small moments of joy, okay? So there's a few layers here, and I'll tell you what I mean. The keyword is going to be small in this statement. We can nurture our well-being by balancing worries with intentional presence. I like to use a beach and the ocean as an analogy here. Sometimes in our feelings of anxiety, we're thinking about the future. What is this going to look like? What new symptoms going to pop up? What treatments are available? Are we going to get in this clinical trial? Or maybe you're thinking about the past. Was I really short-tempered with my loved one? Should I have had us on a keto diet 10 years ago? It could be anything. And that's where we feel overwhelmed, like we're drowning in the middle of the ocean. We find joy on the shoreline. We are able to be present on the shoreline. That's where we can sit on the beach and enjoy the water. So when you are feeling overwhelmed, can you ground yourself to the present moment? Which is really hard to do. It takes intentionality here. And you're not going to be able to do it all the time. Those worries are going to come, and those are normal. But what are things that are lifelines to you that get you to the present moment? What grounds you to the present moment? Is it a person that you can talk to? Is it an activity like singing in your car or playing cards or going to the gym? Like, what can give you a break from those overwhelming thoughts and can get you to the present moment? Because that's where joy is to be found, not in the past, not in the future. In trying to manage those worries so that you can be in the present, think of these 2 buckets: what's in my control and what's outside my control. Okay, you've probably heard this before. Y'all probably are telling this to your kids. You know all of these things. Hopefully it's helpful to hear from someone else. You know, when something is within our control, there's likely something we can do to problem solve, to work towards it, okay? When something is not in our control, there's likely nothing we can do. And so pretending we can control it can be counterproductive, it can be harmful. Can we instead loosen our grip on it and try to let it go a little bit? Validate that it's there, that worry is there, but there's nothing I can do, so I'm going to try to go back to the present moment. For example, if your loved one has a new symptom that pops up that you don't know what it is or what needs to happen for a treatment, you could talk to a provider, you could talk to another caregiver, you could ask on a Facebook group if that's helpful to you. That's within your control. But you can't control the disease trajectory. You can't control the fact that new symptoms are going to pop up that you don't know anything about and you don't know how to deal with. So that part is outside of your control. So give yourself grace and permission to let go of those things outside of your control. And then back to the joy part, the key word being small. I like to think of National Lampoon's Vacation and just think about, like, I hear a lot of times from caregivers that there's this pressure knowing that their loved one has a brain tumor that could steal some of their years, that the caregiver now has to give them a perfect life for the rest of their life, and they have to do every bucket list item, and they have to go to Europe and do all of the things and be happy all the time. That's just not feasible for any of us. And often there's a lot of stress with those big trips too. Think smaller. Think, how can I be just at home and enjoying this small moment at home? Another challenge I hear often is that, well, the patient now can fall and they can't do this thing we used to do together. I'm too tired to do this thing we used to do together. I don't have as much money as I used to do for these kind of things. So I'd also encourage you to think about what you enjoy, what's meaningful to you, and how you can do that in a smaller scale, in a smaller way. So maybe you personally like to run marathons and you don't have time or energy to train for that. And maybe you go on a 15-minute walk every day to honor that part of you. Maybe you and your partner like to go hiking and that feels risky. Maybe you can go find a new park and just sit on a bench together. There are small ways to honor parts of you that are meaningful, that are maybe more doable. And what I will also say is you're going to feel anxious. You're going to feel depressed at times. You're going to feel tired. You're going to feel overwhelmed. And just take those things with you. It is possible to hold joy and hope with all of these other things that we've talked about, all of the more negative emotions, the fear, the despair. So to bring those along with you. And speaking of hope, I want to do one more activity together of redefining hope. Hope is a theme of this conference. Many of you have participated on the writing down what hope means to you, the hope wall. And I read some of those and I was really touched. One was hope that I find a reason to smile every day. Hope that I get to see my grandkids grow up. There's a lot of different ways we can feel hope. I know what we all hope for, and I hope for too, that there's a cure. We need something better than what we have. We know that. And we're fighting for that. There are people that are fighting for that. But what else? What are other small ways you can find hope? Can we take a moment to think about that? And I would love to hear from a couple of people. What gives them hope? How do they redefine hope?
It's been many years since I was caring for my husband. He passed in 2020. But I would say, thinking back to 2016 to 2020, when we were going through treatments, hope for us was moving beyond the scanxiety when we would go into clinic to get results and it would be clear. For us, that was hope.
I love that. I love that.
I want to say that hope is being able to share the small things that make you happy, like your time with your children and your grandchildren. For us, grandchildren, it's really big. Every extra day that you have together with them. And also the new adventures that you have, traveling to new places and stuff like that. So that gives us hope. It's really the looking forward to every new day.
Thank you. Any others? I want to share some resources for y'all. The ABTA has incredible resources. If you haven't already heard about them, definitely look them up. I grabbed a caregiver handbook actually myself. I want to point out too, the UCSF is the first neuro-oncology caregiver program that exists in the United States. I don't work with them. I just think what they're doing is incredible. And they have a lot of really cool resources on their website, including their version of a caregiver handbook. So I don't know, take a look at it, see what you think. If you're in the area, I think they have really awesome therapeutic support, peer support. They have a whole host of resources. And if you are interested in seeing a therapist, look at psychologytoday.com. You're not going to find anyone who specializes in brain tumors. There's about, 3 of us that exist. But you may find people that specialize in cancer. Even if your your loved one doesn't have a malignant brain tumor, they still understand like health threats and threats of mortality. Even if not, if you just have a good therapist, they can meet you where you are. You know, just because people don't understand exactly what you're going through doesn't mean they don't care and they can't listen and be there for you. So those are two that I want to point out. And then I would love to just spend some time hearing thoughts and questions. I'd love to hear directly from y'all, just for my own personal reasons. Anything you have, I'm here, and I'll be here after if we don't get to all of your questions. Okay.
My better half had a tumor develop. It was a spur of the moment thing. 2019, she had it removed. I was in Florida. I get a phone call. Hey, I'm having brain surgery. So it's like I went from having a good time down in Florida, I have family down there, to holy shit, pardon my French. My life just changed because we've been together 16 years, October 31st this year. So
Congrats.
it's been a ride. I mean, from day one, I mean, we didn't know what to expect. She went in, she was supposed to have sinuses, like a sinus surgery. And then went in, they found the mass, and like, yeah, no, we're not letting you leave. So when I got the call, it's like, hurry up, get on an airplane, fly home. And then it's like, my life just changed, trying to take care of her. She was in surgery, and then she was in ICU. And we didn't get all the answers, like, you know, what the tumor was. You know, they said it was benign. Well, what caused it? She was on steroids for 10 years prior to all this, so we didn't even know she had any type of issue. So my question is, you know, she's a survivor. She's still here, which is awesome. I mean, that's something I've been very hopeful for. My question is how, after the tumor's been removed, she went through Christ Hospital here locally in Chicago. How do we find out what caused the tumor or, you know, why it developed? You know, there's no answers and trying to ask the people that were there, I mean, she's gone from this neurologist to these neurologists keep retiring. So it's like, she's trying to get better. She still feels like she's missing something in her life because she hasn't been to anything like this before. She hasn't been getting the support. It's me and her daughter that have been supporting her. So it's been very, very difficult. So, I mean, it's like, what do we do to try to figure out, you know, and how do we prevent it? There's no answers.
Yeah, I mean, and how do you sit with that? A couple of things came to my mind that I want to share. First thing is that what you said about you and your daughter providing the most of support. Caregivers provide the majority of support. They are the people doing everything outside the hospital walls. They're not getting paid for this. You're right. And then what you described with being in Florida and this all happening, there's a word for that. It's called trauma. And trauma is very real, and the changes that happen are reminders of that trauma. I'm a clinical psychologist. I'm not a neuro-oncologist. So I can't tell you the causes of a brain tumor, but I will share, this is just Dr. Willis's 2 cents of causes and what this means from a psychological standpoint. We don't know the cause. And what that means is you have to sit with uncertainty and try not to blame yourself in the meantime. That if you would have done X, Y, and Z, you wouldn't have had a brain tumor, because we don't know that. I hear that a lot. I hear, you know, it's great to have a healthy lifestyle. I don't have a brain tumor and I need a healthy lifestyle. But if it becomes like, I'm rigid about eating this many blueberries and turmeric a day because you think you can control the outcome, we don't know what controls a brain tumor. And that, I think, can get in the way of our joy. I wish I had an answer for you what causes this. And it's really hard to sit with that uncertainty. It exists and it will always be there. And I'm so sorry.
One day at a time.
Yeah, hi. So some of you have met me already. and I was the only person to put up my hand because I am a brain tumor patient, excuse me. I'm not here as an imposter. I'm here for a very important reason. And thank you for allowing me to be here. I really didn't want to listen to everything because it's your show, so to speak. But the reason I'm here is because I'm a part of a group of brain tumor patients at UCSF, and we lost one of our dearly beloved fellow patients in November last year. And prior to that, we had a very important series of discussions among the 25 of us. And he was determined before he died to get some of us, and I'm one of those people, all of us really, but I'm being the one person who's being able to do it, to accept the idea that we as patients need to reach out in a really much more fundamental way to our caregivers. Mm-hmm. And I can tell you personally that I've met many, many patients who feel the same way that I do. And this is because I've been driven partly by the fact that I've been dealing with my brain cancer for 13 years. I'm into my 14th year. So as you can imagine, this has been incredibly hard on my family. Mm-hmm. My wife's father died of pancreatic cancer after 12 months when she was 13. Her mother died 20 years later. 20 years? No, sorry, 1988, from stage 4 ovarian cancer. Death sentence also. And I helped take care of her, so I know exactly what it's like to be a caregiver. I'd been trained in hospice work about 6 years before that. I had to bide my tongue all the time to not get angry with my wife. That's not the way you do it. You know, I mean, I had to really struggle with that. And now I have a death sentence. I mean, in the sense that my brain cancer is going to kill me, except that I'm a son of it, as I think some of you know. I'm an outlier. I'm one of the only people alive on the planet, this planet anyway, after 6 years, I'm into my 7th year, on for a son of it, because I have that IDH mutation. Mm-hmm. So I have a very privileged position. So I speak from the heart here that many of us do want to do a better job taking care of our caregivers. Mm-hmm. And that's all I had to say. And I think you can probably hear that in my voice and my heart. So I wish you all the best. I think of all the caregivers that I know. And you're doing the best you can. Now, my wife, just a personal thing, has done the best that she can. And my sons, I have twin sons. They were 15 years old when I was diagnosed. They're now 29. All I wanted to do was live long enough to see them get out of high school. Then they got greedy when they went to college. Since I graduated from college, I'm no longer greedy. Every day, I think, oh my gosh, I'm lucky to be here. Mm. Meanwhile, my marriage just totally collapsed. Mm. My wife, now this is important to you as caregivers, I believe, has never gone to any kind of support group. It mystifies me. Her response is like, well, it's for me to know and you to find out. This is a very strange thing. Has never consented, shall we say, I'm using that term advisedly, to go to marriage and family counseling. Finally, I filed a divorce in December of last year after a huge struggle for my faith and also the effect it would have on my sons. Mm. So you've just seen two perspectives, the patient and the caregiver. You don't know my wife, but I can say that she's incredibly angry. And of course, she must feel unbelievably betrayed. But I am not the only person who's gotten a divorce, who's been a patient struggling with brain cancer for a long time. Mm-hmm. So that's part of my story. But anyway, if you're interested in talking to me when I'm done, after this is done, please approach me. I'm more than happy to talk to you.
Thank you. Thank you for sharing. And thank you for being so vulnerable in a crowd of people. That was really, really powerful stuff. I'm glad you're here, both here and here alive in the world. You're not alone in having these different problems in our marriages. And sometimes when we aren't talking about the things that really scare us, it comes out in weird ways, and there can be discord between us. I said this yesterday at our session, but in case you weren't there, we found in our research that the patient's biggest concern is their caregiver and their loved ones, and their loved one's biggest concern is the patient. Like, they're both so thinking about the other person and not their self at all, and they're worried that if they bring something up, that they're going to be burdening the other person. So if you're caregivers, you're worried about saying something scary or bringing up your feelings makes them feel even more like a burden. And what I would say is if you two are both worried about the other person, y'all should talk. And it's really hard to do that. Thank you.
This is just real quick. I think many of you probably already know this, but there are several hospitals and medical centers that have social workers that can help you. Social workers are not just there for the patients, they're there for the caregivers and to kind of help you through the emotional kind of roller coaster. So, reach out to the neuro-oncology team there or to the hospital where your loved one is receiving treatment and ask to speak to a social worker if you think that could be helpful.
Thank you.
You mentioned the word trauma earlier, and I think the initial diagnosis in our case and the surgery that immediately followed was definitely a traumatic event. People tend to do very well showing up to support you during trauma, but hopefully this is a long journey for us, and I'm worried that our support network is there for a sprint and not a marathon. So I'm wondering if you can speak to, or maybe some of my peers in the room can speak to, how to successfully get support for the long haul instead of just during the initial traumatic event.
Poignantly stated, and I've found that empirically in research, exactly what you're describing. They're almost too much there in the beginning, like it's overwhelming, and then where are you when I need you later down the course? Y'all are the experts, so I want to hear from y'all, but what I would say as a therapist is that you have to use your voice. You have to say it. They can't read your mind. People, I believe, have good intentions and a good heart, and they just don't know what to do. They haven't gone through this. Maybe you could say, can you please check in on me every 3 months and just see how I'm doing? But if other people want to chime in on this and see how they've navigated this, I'd love to hear from them.
Okay. I just want to suggest, if that's an issue, because we also, have that, and I'm like, I don't need all this help now. But for other friends who've been through it, we've just asked some, I have done this or someone else has done it, set up, there's all sorts of things online, a meal train, you can do it with kids thing, and spread it out. Spread it out over a period of time and say, I will need this for the next 6 months if you can help me get, 1 meal a week or something. That I think that that's really helpful because, I have said to so many people, this is going to be in the long haul. Just hold off. I don't need food right now. I can cook, I can, things like that. But I think, if you're feeling like you need it, it's a way to think about spreading things out so it's not on there and just asking someone, can you set this up? And I think that a lot of people want to help and don't know how, and it gives them a thing to do at a specific time.
I love that idea, just thinking in real time. Like, maybe you have a confidant in your life that can be your advocate. That is, maybe it's a close family member that's like, okay, my job is to figure out the next 6 months and ask people for stuff throughout this journey. And so that you're not having to care for the patient and figure out the long haul of this.
Okay, maybe we have time for one more.
It's real quick.
Okay.
Mine is completely off topic. In some of the social groups that I'm in for caregiver groups, brain tumors in particular can change the personality of the patient. And I was wondering if you had any comments. I haven't experienced that, but it's a little bit scary to know it can happen.
How hard is that? The person that you love is different. I think the word that comes to my mind is grief. And, you know, the person is new. There's parts of it to be grieved, but maybe there's parts to be celebrated. Maybe the person is like a little less inhibited and says what's on their mind, and maybe that's kind of funny. And maybe you can find small moments of joy there. I know that it can be really hard to see someone, I've heard anticipatory grief, like fade away or change before the actual death. And just that's one of those things in our can't control bucket that we just have to hold and validate and ride the wave and do our best in the meantime. It's hard.
Okay, that's all the time we have for questions. Thank you, Dr. Willis, for a wonderful session on nurturing caregivers' well-being. Can we thank Dr. Willis?
Thank you. And I want to thank my caregivers who are here in the crowd. My parents came to watch me speak this weekend. And so just to say that no one can do anything alone.
Okay, we'll now take a short break. We encourage you to check out the exhibit booths one last time for the passport contest. Winners will be announced at the close of the event, and then after the break, we will reconvene in the Utopia Ballroom at 2:15 for the rest of the program. And virtual attendees, please go back to the agenda and click on the next session to join.